So when we were planning this session, and there's another session just afterwards, which is about AI, organized by a specific Greek institute that will deal with new AI things in Greece at least. So we thought that we need to make a transition between capacity building and AI, because I think at the end of the day, we will need to restructure a lot of the things that we will do in the future generations, and also include, in theory, AI. So there is a series of presentations, and I have my good friend Kostas Patikis as well that will make one similar, I guess, to try to link the two things, and so that then if you want, that the ones that would like to go to the next session, which will be in Greek but with translation, so you will be able to follow it pretty normally, I think. So my initial viewpoint is to see how can we organize the stakeholders around AI to try to organize so that AI is working properly in the context of the European Health Data Space regulation as well. So in practice, when the regulation was created, and we'll discuss a lot about it in the next 2 days, it has been designed in a way that it fits with other similar regulations and laws in Europe, so that there is no double work or no double thing that any stakeholder will have to contribute. So that's one thing. I will not say a lot of things on the European Data Space regulation, because we will have a lot of discussions about that, and we will have a presentation just after about what are the conjunction between the AI Act, for example, and the European Data Space regulation, so that try to connect the two. So, but basically the vision behind all this regulation in Europe is that we want to try to create a European digital health market in the healthcare sector, try to harmonize it as much as possible, and try to work in a way that we trust the systems that we're using. So try to certify them in an incremental approach, and there is a pathway around that. So we see a lot of these type of regulations, the medical device regulation, the cybersecurity cycle, and now the European Health Data Space, that are working in that environment. So concerning, let's say, the AI and how this fits more or less with the concepts of what is mentioned in the European Health Data Space regulation, we try to identify some possible opportunities, let's say. So the first one is that through the regulation and the adoption of the exchange format, we most probably be able in a few years from now to enhance access to high quality data. So the high quality data will be obviously reused on the primary use of care. So, and there will be AI tools that will be working to support treatment and prevention. But also it will allow us to create better analysis of all these. Since the data will be structured, we can also reuse them for secondary use of data in many cases. So this will also somehow accelerate, and we hope that it will accelerate research and innovation and different tools. And there are a lot of EU-funded projects that are in this direction, try to reuse new AI tools for both prevention and treatment. Also, another important topic that we see a lot in healthcare is mostly the collaboration of healthcare professionals with their patients, and there are a lot of tools that have been created, and especially a lot of data nowadays that are driven, real-world evidence data that are coming from the interaction between the clinicians and the patients. So we are now able in the treatment process not only to use data that are coming from the clinician activities, but also from the contribution of the data that the patient themselves are contributing to their own health. And of course, very important and very well stated in the regulation, how can we work together to enhance public health? And potentially AI can analyze a lot of data to allow us to do a lot of early detentions, because the regulation was streamlined and worked a lot because of the pandemic crisis of COVID. So the idea is how can we organize ourselves so that we don't have another pandemic where we are not able to respond as a unified environment in Europe. Now, challenges, of course, there are a lot of challenges, and AI experts, and if you have read the AI Act, you will see a lot of things there in collaboration with the European Health Data Space. So there is a huge part related to data privacy and ethics. I'm not personally an expert on that, but that's a topic that we need to think about. There is an important set of data standardizations and a lot of things that will come out of interoperability. The exchange format will be one topic, so an important contribution from the joint action that we'll hear a lot again tomorrow. But also a lot of issues related to governance and how we're going to organize this so that we have ethical roles. And I think these things are very well structured in both the AI Act and the new regulation for the European Health Data Space. So, and if you read all this material at the end, it really mentions that we will need to do, especially for the AI tools that will be considered as high risk for the patient safety at some point until they are proven otherwise, that we will need to do a lot of rigorous testing and certification. So that can mean a lot of things. So trying to align a little bit what is happening with what is happening in the regular, let's say, way of testing in the, let's say, digital transformation and interoperability in Europe. This is just an example of the testing continuum that has been seen by IHE, for example, where a lot of testing can be done in an organized way by having common specifications like the IHE integration profiles, for example, and then, of course, do project-based testing. So how do we orchestrate all those specifications so that those specifications make a real sense to the end user? So that's the important difference between a connectathon and a projectathon. An important thing about governance, because this is the two topics that are, I think, important and are correlated between the different acts in Europe, is that you need to govern interoperability in a very organized way. And this is just based from the experience that started in Europe since the anti-law project and EPSOS a long time ago. There is a clear path of that and the need, not only at the European level, but also at the national level, to start organizing the information into an interoperable framework. And some countries have already done that. Some others are thinking of it. But I think this, if we manage to pass the message that this is necessary, a lot of problems will be, in theory, solved. Now, coming back to the stakeholders, I think an important thing, and this is something that we worked a lot in a preparation project, Expand DH, in preparation for the new regulation and as a supporting mechanism also for what is happening now in the joint action. The idea was try to see, we are creating those specifications, the exchange format, all these things, but you need really to go down to the real users and try to find use cases that are designed by the users themselves, the community, the stakeholders that will need them. So we started this concept of the community of doers and co-creators, and we experimented on some use cases, try to bring at least the three basic communities all together, meaning the group of programmers, the group of from the healthcare sector, the professionals, and the patients. So the three main communities to try to conceive some use cases. And we worked a lot on the oncology domain, on the telemedicine domain, on the e-prescription domain. And we tried to create some teams to prove that this concept is correct. And we also created a methodology that you can also find online. We have created, as a result of Expand DH, a paper about creating such type of communities. So you can reuse this material if you want. So at the end of the day, all these things, so that they work as stakeholders, AI included, we need to make communities of people first before making any types of other communities. And this is how important, this is just some pictures that we just taken out of similar communities of users working together to create together the scenarios that they want to implement. And it's coming from the community in Latin America and the Caribbean, where they are working specific use cases together, first designing them from the user side, and then asking the industry and the technology to implement them and test them before implementing them. So I think that's a nice process to think about, also related to AI. And I mean, at the end of the day, try to summarize a little bit this short introduction between AI and the European Health Data Space regulation. I think we have some implications that we need to think of. So there are implications for the AI developers and the innovators. So they need to start thinking that their system needs to be open and interoperable on one hand, and they will need to be testable as well. We need to focus for the healthcare providers we need to think about use cases where AI really gives value and helps the clinicians do their work properly and not replacing them, because unfortunately in some cases the clinicians, they feel threatened by the new technology. So we need to revise a little bit our thoughts, how we can be supportive in their work instead of making them think that we are going to replace them. And of course, for the policymakers, we need to ensure that all this regulation doesn't create a huge burden and overload to all the stakeholders, so that this is as much easy to implement. And in some cases, we saw, especially for the medical device regulation, that is sometimes too complex and there is not enough time to prepare. So let's see how we can not make the same issues with the AI Act and the European Health Data Space Regulation. So just some examples. The others that are more qualified than me, but I just made a small search on the internet and I found several categories where AI could be very important in healthcare. So there are predictive analytics, personalized medicine has mentioned here a lot, drug discovery and development, fast track the development of new medication, AI and radiology, especially IHE has a profile for AI, and there are some use cases that can be tested now. So you can test your systems if the algorithms are really doing what they are promising. Public health surveillance, remote monitoring, telemedicine, also very important, and many countries are going that way to reduce cost. Health equity and try to bias mitigation, and also use new technologies like natural language processing and things like that to automate probably the reporting. So all these things and tools, we will have tomorrow discussions in the providers forum and the patient forum. Maybe some of those tools can help us build better and more user-friendly solutions based on for the new regulation. So what's next? We need to focus on more interoperable AI systems. We need to have easy to understand and transparent AI so that it's not strange and we can build transparency and trustworthiness on this. Try to work cross-border because the European Health Data Space Regulation about collaborating at the European level, and also try to create all these systems in an ethical approach, so ethics by design. I think those would be some initial messages for the discussion. So with luck, I would like to thank you very much, and I hope I gave some good insights for the future.